back. This is the Premier Mindset by Premier Performance LLC. I'm your host, Trent Mailer, LCSW, and this is episode 11. Information's in the show notes. There are videos of the episodes on YouTube, Spotify, Apple Podcasts. Doesn't have that video feature, but you can still find the episode there. We will share clips as well on social media. If you'd like to get it somewhere else, or if you want access to it somewhere else, just let me know. Reach out, give us some feedback on that, and we'd love to put it up in these places. We've put it in most places where most people get their podcasts, but if there's anywhere else you want it, just let me know. Please leave reviews, like us, follow us, favorite us, subscribe, all of these good things to make sure you get the content as it comes out. I want to make sure that you're getting the alerts and know that these things are coming out so you can take advantage of it and just get to work on these things and get something from it. With this stuff, this is not a replacement for therapy or medical treatment if those are things you need. If there's something going on, let's go take care of it. Don't hide from it. Don't run from it. This is purely educational. I want to give people some information. I want to help people understand how they're working. I want to increase the awareness and hopefully point you guys in some directions to get what you need to just live a better life and have things just work out better in the long run for you guys. Life is pretty hard and we want to make it easier if we can. I make it a point with this to give you guys actionable tools that you can use to help you find success in your life. It's all evidence-based. It's not just random things I'm throwing at the wall. And a lot of that is because I want this to work for you. I don't want to just give you things to bog you down. I want to give you things that work, and I want to give you the research behind it so you understand why it works. There's a lot of different ways to reach out. If you have questions or concerns or anything that you want to get into deeper with me individually, I'd love to help out. If there are things you want me to cover on future episodes or go more in depth with, just let me know. We can always do those things, and I love any kind of feedback you guys have for me, so feel free to reach out. The ways you can do that is through email. My email is tmailer@premierperformancereno.com. My last name spelled Mahler. You could text or call at 775-561-0056. We got the Instagram, premier_performance_Reno. The TikTok, premier_performance_Reno. And the Facebook and LinkedIn page, Premier Performance LLC, for both of those. So check us out, follow us on all these platforms, make sure you get access to this stuff. I want to make sure it gets to you guys because that's the point of it. I'm hoping that this stuff just helps you out and pushes you forward in some way in your life, and that's the goal. What we're going to cover today is the topic of ADHD as well as medication. They kind of go well with each other, and being that our last episode was about drugs, I want to go a little deeper into the prescription side of things so you guys can understand how this stuff works and what we can get from it as well as what to look out for. ADHD is a big topic nowadays, so that's another thing I want to cover and make sure to give you guys some information on just what it is, what we can do about it, and how to manage it, because I think there's some, half-truths out there and some misconceptions of what it is and what you can do about it, and I want to kind of try and set the record straight a little bit and help you guys understand it. With that said, let's jump into things, and let's start with our brain activity to get going. And what this brain activity for this week is called the brain dump and prioritize. The way to do this is you want to sit down and write everything on your mind down with a 3-minute timer. So you can just put like your phone on as a timer, or you can have an actual like kitchen timer kind of thing, whatever you want to do. But just write down as much as you can, anything on your mind, even if it doesn't make any sense, for 3 minutes. When you finish with that, the goal is to go back and then circle 3 things that you need to focus on the most today, and then get started on those. What this is going to help with is it's going to help us prioritize, and it's going to help us recognize what things is just kind of junk flowing around in our head and that we're not really needing to pay attention to it or do anything with it. Sometimes we get caught up on ideas that there isn't much to do with. So we want to make sure to get those things out of the way, make sure to understand what should be the priority and what things we can kind of just put on the back burner or even just not worry about altogether. You'd be surprised at how much stuff goes through our mind on a daily basis that we actually don't need to pay any attention to or do anything with. We love to give power to thoughts because we think a thought means something just because it's there. But we got to keep in mind our brain's an association machine, and anything it sees, it's going to associate with stuff, and we have random things pop up. That's why we have random thoughts. So not everything means something. And sometimes we got to prioritize that focus and understand where we need to put it. And the best way to do it is to really dump everything out and then start to clear it out and have that bird's eye view of what we need to put that focus onto. So give it a shot. If you guys like it, that's awesome. Keep doing it. It's going to be probably helpful to just, get the day started and prioritize your focus into some areas that are going to help you do better and be more successful. If you don't like it, that's totally fine. We're going to keep giving new stuff every single episode, so at some point, stuff will start to click for you. But the main thing with all this is you just got to try it. And you don't have to believe it's going to work fully, but you just got to try it out and be open to it. If we believe it's not going to work, it's really rare for things to work, even if they are set up in ways to work. So just give you guys yourself a chance to try it out and see where it goes. Hopefully this stuff helps out, and if it doesn't, or if it does, I'd love to hear about it. Just let me know. Now, let's get into it. What is ADHD? ADHD is a chronic condition including attention difficulty, hyperactivity, and impulsiveness. ADHD often begins in childhood and can persist into adulthood. It may contribute to low self-esteem, troubled relationships, difficulty at school or work, and symptoms include limited attention and hyperactivity. A lot of this goes back to that fight or flight system we talked about on episode 1, that threat system. I go back to that episode all the time because that's kind of that foundation. So if you haven't listened to that first one, go give that a listen. That's going to be that foundation we build upon, is that's understanding how our body's working and what's going on with this stuff. I will probably revisit it in the future just to kind of give refreshers, just because it is that foundation. But if we think about that fight or flight system and how it's working, we have the fight, flight, freeze, faint, fawn, all of those responses that come with being under threat. And ADHD is a form of flight. What it is we don't want to pay attention to something that feels stressful, boring, threatening, whatever it is. The issue is getting up and actually leaving leads to more problems, more issues often, so we tend to sit there and just let our mind wander instead. So it's kind of its own avoidance mentally instead of physically getting up and leaving. As some of you have seen or know, with ADHD, it's not that we can't focus. If we find something of interest, we can focus onto it for hours and get some really amazing things done. And it can kind of be a superpower if it's formed and focused the right way. But if it is focused on something that we aren't interested in, that feels a little more boring, that causes that stress response, then our mind starts to wander and we stop to pay attention and things don't work out the same and we don't get the information we need. So it's understanding, what is that threat? What is it? Is it me being bored? Is it a stress of a situation? Am I worried about something else going on and that's just taking priority, kind of going back to that Maslow's hierarchy we talked about? Or is it something else? And that's where recognition really helps out, diving into these things to understand like what's happening and why is it happening. But that ADHD is just our brain trying to avoid certain things. So we want to understand that, and we want to understand the root of it so we can take care of it and get it focused and take advantage of the superpowers that come with ADHD. We just got to set ourselves up for it. There are some ways we can increase focus. There are some activities we can do directly to increase focus, and there is some things we can do in our everyday life just to increase focus in general. There are always vitamin supplements that you can do that can help out. You know, the first one that comes to mind is like lion's mane or any anti-inflammatory properties, because these things can really help get that focus back and line up with what we're looking for. We talked in the past about a book by Dr. Daniel Amen called Change Your Brain, Change Your Life. And the idea of that book is really focusing on how to supplement your body, how to do different things in your life to really change these things up. And it does focus on some ADHD. And he has some other books that go a little deeper into ADHD as well. So that could be a good resource if you want to get more in the details of what you can do. But I'm going to give you guys a couple things so you can get into it now and just see where it takes you. First thing you can do is focus on mindfulness. And I know we talk about mindfulness a lot. And the reason for that is, again, it's kind of a foundation. It can help us do a lot of things, and it helps us process a lot of things. So we're going to come back to mindfulness in a lot of different ways. It's going to help give us control. A study found that mindfulness can get wandering thoughts back on track. Mindfulness, which is the ability to intentionally focus attention on the present moment, controlling that focus, building that muscle, can be effective for reducing mind wandering through results, though results do differ depending on the research methodology. So they have found various ways to look at it, and it's different for everybody, so this isn't like a one way of doing it, but it can help us just build up that muscle of control of our focus, because that focus is kind of like a muscle. The more we work with it, the more we control it, the better control we have of it. The less we do with it, the more we just let it lead us, the more it's going to lead us. So we want to try and use that mindfulness as much as we can, and that could be mindfulness activities. It could be specific mindfulness activities focused on focus, or it could be something that's just mindfulness in general, like mindful eating, like we've talked about in the past, or other things. Speaking of eating, Another study showed that diet plays a key role in ADHD symptoms in children. There's a good reason for children with attention deficit hyperactivity disorder, ADHD, to eat their fruits and vegetables. It may help them reduce inattention issues, a new study suggests. The study that evaluated the effectiveness of the supplement showed that children who took the micronutrients were 3 times as likely to show significant improvement in their ADHD and emotional dysregulation symptoms than those who took a placebo. The study was published last year in the Journal of American Academy of Child and Adolescent Psychiatry, and researchers believe that ADHD is related to low levels of some neurotransmitters in the brain, and vitamins and minerals play a key role as cofactors in helping the body make those important neurochemicals and in overall brain function. That's important because Western diets are more likely than many others, such as the Mediterranean diet, to fall short on fruit and vegetable intake. So that's something we really want to incorporate and see if we can change. Going back to self-care, it sets us up for success. If we're eating the right things and doing better things with our diet, it's going to really help us out. So let's play around with that and see if we can get more of those things in there. If you want to follow on to something, leaning on that Mediterranean diet kind of structure can help out a lot. There's a lot of research showing benefits from it, and that can be a good one to kind of lean on if you want to structure. Another study found that omega-3 fatty acids, and in particular DHA, are associated with increased attention scores in adolescents. So fish oils, omega-3 fatty acids that you can get from eating fish in general, supplement fish oil like I was saying, you can do that. There's other things you can do as well, but increasing that can help out. And if you get deeper into that rabbit hole of omega-3s, there's a lot of really good things coming from it, and they've shown a lot of benefits in our life in general about it. So that could be a good one just to get onto. Even if you're not having issues with attention, that's a good one to explore a little bit. Another study found identifying body scan postures suitable for people with hyperactivity tendency, and this kind of focuses on the mindfulness aspect of stuff. The study suggests that adopting a supine or upright posture facilitates ease of performing body scan meditation for people with hyperactivity tendencies. So that's more of just sitting upright, having a good posture, like you've seen from like a stereotypical person like meditating or something. They're literally sitting up and really straight, their shoulders are pulled back, all these kind of things, just really good posture has shown to help out with doing these kind of meditations, making it easier to get into. Mindfulness practices have been found to be effective in reducing symptoms of attention deficit hyperactivity disorder, ADHD. However, many people with ADHD may find static meditation techniques challenging. Those sitting still, just breathing, laying down, whatever it is. So in a recent study, researchers assessed individualized responses of people sitting in various postures during body scan meditation. The findings suggest that a slump posture may reduce the ease of practice, while supine and upright positions may improve the ease of meditation for people with high hyperactivity or impulsivity tendencies. So if you try and do mindfulness practices such as meditation and it's difficult for you, try and focus on the posture and the breath while you're doing it and see if that makes it a little bit easier or just kind of helps you get into it a little bit more. Another study found managing stress could be the key to helping highly impulsive people act rashly when bored. Research has explored the relationship between high impulsivity and boredom in an effort to find out what drives rash and sometimes unhealthy decisions. Boredom is a form of psychological stress for most people because it is a state of restless dissatisfaction and often leads to individuals to seek out stimulation. That's the idea of that flight and kind of mental flight of like daydreaming or getting stuck in our head or getting lost thinking about other things that don't have to do with what we're doing right now. Another study shows that evidence suggests high dose supplementation of B6 is as effective as Ritalin for ADHD, and low folate status in pregnancy is linked to hyperactivity in children. So these are two different things that kind of connect back to supplements that we can take, B6 and folate. One's connected to pregnancy, the other one is just in life in general. B6 is pretty helpful with a lot of things, so you can look into that. But being mindful of folate in pregnancy is a big thing. They talk about it a lot while going through pregnancy for anyone who's done that. But that can be something to just keep in mind and something to think about or even talk to your doctor about, see if we can get onto and see if that helps out. With this, there's people that have MTHFR. It's a crazy word. I'm going to try my best to say it, so if I say it wrong, my apologies, but it's methyl tetrahydrofolate reductase. So people that have that gene, they are predisposed to folate deficiency and more likely to have ADHD. That connects back to that low folate status in pregnancy. So again, being aware of folate and folate deficiency. I mean, in general, it's always good to know if you have deficiencies in general, because we can take care and supplement a lot of these things, and it's hard to get all this stuff from our just everyday eating. I know we try our best to do that, but sometimes it's hard to do. So supplementation isn't bad. I take vitamins every day. It's not a bad thing. It can really help out and it can cover some gaps. Magnesium deficiency is another one that they have found, as it's linked to poor function of the neurotransmitters that control emotion, social reactions, hyperactivity, and attention. Maybe we need to add in some magnesium too. That can help out a lot. Magnesium is also helpful if you find yourself like grinding your teeth at night, having a lot of tension. It can kind of relax the muscles and help you just release a little bit of stress. So that can be a nice one to look into too. The precursor for the calming neurotransmitter GABA that affects mood, focus, and hyperactivity also shows a disruption of the glutamine containing neurotransmission system may cause ADHD. So exploring different neurotransmitters and how this stuff relates to ADHD can be another part of it. You don't have to get super deep into all of this stuff. I think a good thing to take from it is just vitamins and supplements that you can take for yourself to make sure your body's getting what you need, and just maybe doing some testing, some blood testing to see if anything's low, anything you want to get up, and just, exploring those levels and seeing what works for you and what doesn't. With ADHD, there is this thing called the wall of awful that can be pretty common. There are great videos on it. If you want to explore it visually, feel free to check that out. I can't really put them on there for you guys just due to copyright issues, but I'm going to talk about what it is so you guys understand it a little bit and that you could look into it yourself if you want. The wall of awful is the idea that something that should be easy or feels like should be easy actually is really difficult or hard to do. Maybe it's hard to get ourselves started. Maybe it's hard to get ourselves to do it at all. Maybe we keep pushing it off. Maybe we keep avoiding it. Maybe it's something else. The wall of awful is this giant wall kind of we have in our own mind that stops us from doing certain things and kind of pulls us back. There are some ways to get past that wall, and it just takes a lot of effort to get there sometimes. But if we don't manage it the right way, we easily fall back into our kind of primal stress response, that fight or flight system. And the way that plays out is in fight, you get the kind of Hulk smash. I'm going to smash through the wall just to get to the other side. And that can work. You can get to the other side, but the way you Hulk smash is usually through anger. So you're getting angry at people around you, like being upset that you got to go do the dishes. It's like, all right, fine, I'll just go do the dishes. And you're pissed off, and you're angry, and you're snapping at someone about it. And that's going to damage that relationship, going to make things harder later. You could also Hulk smash inwardly and kind of cause problems for yourself. That would be beating yourself up, saying, why am I so bad at these things? Why can't I figure things out? All this kind of stuff. Just kind of really taking down and sinking that self-esteem, making yourself feel bad. Another part of it would be flight. That'd be trying to avoid the wall altogether, just like not doing the thing. That doesn't work, and it's going to keep that wall there, and it may even add more bricks to the wall, making it taller. So we don't want to avoid things. Anything that we want to avoid, we want to go after and go take care of. Getting after these things can be tough, but it usually leads to the things that we want. Sometimes the very cave we fear to enter holds the treasure we're looking for. So don't be afraid to face these things and embrace these things. And keep in mind that avoidance doesn't work, and we just push things off for later, and it hangs over us the whole time anyways. Sometimes the best thing to do is just to do it. We also have freeze, which is just kind of like stare at the wall, like stare at the thing. Like maybe you pull out your computer to do some work and you just can't get started, and you're just like staring at a blank page. So sometimes the best thing to do is just get started. And it's a lot of mental and emotional work to climb that wall of awful. Maybe we got to sit down and think about it for a little bit and then get ourselves going. It's just like a longer runway. Maybe we got to motivate ourselves in some way or get ourselves engaged in some way. Maybe we got to build something up before we get into it to see if we can get started. But the best thing to do is to try and face these things and just give yourself some time and patience to get up that wall. Really, the understanding of that wall of awful is about, like, let's not beat ourselves up and cause more problems as we're trying to climb it. It takes time, it takes effort, it takes intention. So let's take our time with it and let's get to the other side, and then let's keep going. Let's not make things harder for ourselves and get stuck on it. Now, coming back around a little bit more to ADHD. ADHD is connected to substance use quite often due to this kind of idea of trying to self-medicate. A study found a consensus of literature suggests that when there is a dysfunction in the brain reward cascade, especially in the dopamine system, causing a low or hypodopaminergic trait, the brain may require dopamine for individuals to avoid unpleasant feelings. This high-risk genetic trait leads to multiple drug-seeking behaviors because the drugs activate the release of dopamine, which can diminish abnormal cravings. This is why attention deficit hyperactivity disorder and reward deficiency syndrome can cause a lot of issues and kind of set us up for substance use. It's pretty common to see people self-medicating for their ADHD with certain things, and keep in mind a lot of the prescriptions we get for ADHD are stimulants. So naturally, people seek out stimulants without even really realizing it to treat these things because they take it and it feels good and gives them that benefit they're looking for. It just comes with a whole lot of other cons too. So it's common to see people with ADHD trying to self-medicate this stuff with things like cocaine or methamphetamine or even caffeine. So keep that in mind and be aware of that stuff, especially if you have, that ADHD quality. You want to be very careful of drugs like that because it can start kind of creating this system and this cycle that it's easy to get stuck into. We want to be careful with that. We don't want to get lost in this stuff. That causes a lot of problems. So be aware of that common aspect of self-medication. It happens a whole lot more than you think. We just don't really think of it that way. We think of it more of just like substance use. But if we really zoom out and look at what people are doing, it kind of makes a little more sense of why they're doing what they're doing. ADHD has a huge impact on individuals who have it, families around them, and relationships they have in their life. And I think it would be good to just focus a little bit on that through some research real quick, and then we can keep jumping through all this stuff. So a study has found that the framework of family-centered, focused on breaking down the barriers that families face from before diagnosis to preparing children with ADHD in the future can help serve as a model to develop engagement interventions that will be more beneficial to families. There are 6 stages of engagement that the research team identified that are helpful while going through this process of ADHD treatment. The first one is normalization and hesitation. So normalizing the behavior, normalizing the thing, and the hesitation to get started. The stigmatization and fear, being worried about what people are going to think, and the label, and the fear of what this is going to mean, and how the rest of my life is going to look, and all that. Action and advocacy, that's jumping into it, whether it's intervention or fighting to get things for other people that might have the same struggle or similar struggles. Communications and navigation, talking through things, working through things, kind of navigating that path to getting what we need to feel better and have things go well. Care and validation, understanding, giving people what they need to kind of manage this stuff, and even giving that validation and care to ourselves. And preparation and transition. So going through these stages of engagement, they unfold in families in a similar way to a typical developmental process. Hampered by providers and parents being at different stages in the process can be problematic. Sometimes you do find people are at different points at different times, and they can conflict with each other and cause more issues and more stresses. This is known as stage mismatch. This can cause difficulty and conflict, interfering with the engagement in treatment. Researchers found that any difficulty patients feel in resolving earlier stages in the engagement process could interfere with successfully navigating later stages of the process. Kind of going back to like we talked about before with Maslow's hierarchy, you kind of have to hit those bottom levels before you go up. And that's pretty common with a lot of different things. That's why I talk about this stuff, is they just kind of keep coming up. And as we'll get into a little more at the end of the episode, is kind of laying the stage of where we're going with this stuff and why I'm putting all this stuff out here the way I am. I know a lot of it's kind of bouncing around right now, but that's kind of on purpose. Within each stage, interventions could be offered to support families in that phase to help them journey successfully to the next. During stage 2, parents explained that discrimination based on race or ethnicity intersected with ADHD stigma in their community, which led to delays in care. Interventions would target discrimination and bias among healthcare providers, as well as address misconceptions about ADHD within families and communities. So there are things we can do, there are ways we can help people through this, but we want to understand that those stages are there, and that's a very common, normal thing. We just got to help people through it and help them understand that they're going through it. Another study found that ADHD is linked to hoarding behavior. Overall, we found that people who have been diagnosed with ADHD had a higher likelihood of also having hoarding symptoms. Hoarding would be, just keeping as many things as you can, not really willing to get rid of things because you never know when you might need it. And we just kind of start keeping stuff so much that it starts creating problems, and that's when it can become a disorder. There's a lot of shows on this stuff where you can see it, and sometimes you even see therapists working with people go through this stuff, so that can be kind of interesting. But this is just something to keep in mind, that this is a tendency that is linked to ADHD. This is important because it demonstrates that hoarding doesn't just affect people later in life, who are typically the focus of much of the research so far into hoarding disorder. This can happen very young as well. As many as 1 in 5 of adults with ADHD could have significant hoarding symptoms. So keep that in mind and be aware of that. Just kind of pay attention to what we're doing. Recognition is the first step. If we don't know something's happening, we can't do anything about it. Another study showed that researchers found that ADHD traits were highly predictive of the severity of anxiety and depression symptoms. The higher levels of ADHD traits, the more likely a person is to experience severe mental health symptoms. Through innovative analytical techniques, the study authors further confirmed that having more of an ADHD personality was more strongly linked to anxiety and depression than autistic traits. Adults with ADHD are nearly 3 times as likely to develop dementia than adults without ADHD, according to a study by Rutgers. So this is another kind of thing to keep in mind, that while it can give us more severe mental health symptoms, it can also give us later issues in life, such as related to memories, like dementia. So we've got to keep in mind with this stuff, and that doesn't mean that's going to happen. It's just a probability thing. But we want to jump on these things and try and take care of it, because if we leave these things untouched, they typically lead to more problems, and I don't want that for you guys. Yet another study goes into how parents can help prevent the development of ADHD symptoms. ADHD can be stemmed through specific parenting behaviors, according to the study. A collection of early traits we call exuberance in child temperament, such as high excitement, curiosity, and positive responses to unfamiliar people and contexts, combined with family factors, might predispose some kids to develop ADHD symptoms, said Dr. Heather Henderson, a professor in developmental psychology at Waterloo and the co-author of the study. This work demonstrates that parents can really help break down the pathways that lead to ADHD through more directive and engaged parenting behaviors, such as guiding the child with verbal and physical cues as they encounter new situations. The findings suggest that ADHD symptoms increase throughout childhood when a child shows early exuberant temperament, low to normal executive functioning, and receives less directive and engaged parenting as the young child navigates new situations. So if you find that exuberance in your child or in others' childs, we want to make sure to really direct and engage with those children as they're going to go through these new situations and navigate new relationships, and help them manage things, because that can lead to just things going better. If we just let it do what it's going to do, things can kind of fall apart and lead to more problems. Another study links household chaos with sleep quality among teens with ADHD symptoms. The study explored the important role of household structure and stability for healthy sleep in teens. A new study found that household chaos and sleep hygiene are important factors in the relationship between sleep quality and ADHD symptoms in teens. Flannery noted that it's important for adolescents and their families to know that it is more than just individual characteristics that can impact sleep. While improving sleep hygiene and use with ADHD may be beneficial, a household characterized by a lack of structure, routine, stability may undermine the adolescent's sleep quality. So this goes back to that structure again, of kind of the engaged, directive. It's not controlling everything. We got to give people room to do what they need to do. But having a little more structure, especially for kids that have ADHD or have tendencies that are ADHD-like, we want to make sure to give them that structure, because when they lean on it, it tends to work out better for them, and it leads to what they want, and they kind of develop more of a management of this system and not getting lost in it. Now let's jump into ADHD and medication. The reason I want to do this is I think there's some misconceptions of how medication can help with it, and I want to put out there that medication can be a life changer for ADHD. It can cause some amazing changes. It can help us do some amazing things. But sometimes we look at this stuff as just like a super pill that's just going to fix it all, and we just take this thing for the rest of our life, and it is what it is. And there's a lot of people that take ADHD medications that don't really need them, like Adderall and Ritalin, those kind of things. It's pretty common in college and high school. It goes around in some professions as well. But we want to be aware of this stuff, and we also want to be aware of putting kids on it super early, because it is chemically pretty much the same thing as methamphetamine. The first study we're going to go into is talking about the idea that medication doesn't help kids with ADHD learn. Children completed 2 consecutive phases of daily 25-minute instruction in vocabulary and subject area content in science and social studies. The instruction provided to each student during the 3-week phases was at their determined grade level. Certified teachers and aides taught the material to groups of 10 to 14 children in a classroom setting. Each child was randomized to be medicated with a sustained release stimulant medication during either the first or second of the instructional phases, receiving a placebo during the other. Contrary to expectations, researchers found that children learned the same amount of science, social studies, and vocabulary content whether they were taking the medication or the placebo. So they learned the same, whether they're on the medication or whether they're not. While medication did not improve learning, the study showed that medication helped children complete more seat work and improve their classroom behavior as expected. When taking medication, children completed 37% more arithmetic problems per minute and committed 53% fewer classroom rule violations per hour. So really what this is showing is that it's not helping them learn more, but it's helping them stay in their seat more and follow the rules more. So again, especially if we're having a lot of behavioral problems related to it, it can change our life to take these medications. But the idea of putting a kid on this medication is going to lead to them learning more and just focusing more in school isn't necessarily true. It's going to keep them in their seat more. Stimulants are most effective as a supplemental second-line treatment option for those who need it and at a lower dose than typically prescribed. Additionally, the Society for Developmental and Behavioral Pediatrics has published new clinical guidelines that strongly recommend behavioral intervention as the first-line treatment for youth with ADHD. It's very common for people just to jump to the prescription medication right away, and I've had some clients coming in very young ages already on some pretty high levels of meds for this stuff, and oftentimes we really stop doing them, do the behavioral intervention, and everything's fine and they don't even need the meds. So we want to be aware of this, that we can try behavioral interventions first, and it's actually preferred to do that. Work with therapists, work with people that can help support with this stuff. It's going to help a whole lot more, and it's just going to close that door of possible risk of setting up maybe substance use later, because that line between methamphetamine and like an Adderall is very, very small, very thin, and if you stop taking it as you're getting older, it's very easy to just kind of fall onto that and start self-medicating with something very similar, and that can lead to a whole host of problems by itself. Our research has found time and time again that behavioral intervention is best for children with ADHD because they, their teachers, and the parents learn skills and strategies that will help them succeed at school, at home, and relationships long term, which just works out better for everybody. I understand the issues in classrooms that can come out and the problems that some teachers can have, but when we just jump to that first idea of like, let's just medicate the kid, sometimes it leads to more problems and issues, and we don't want to get stuck in that. Another thing to keep in mind is ADHD stimulants may increase the risk of heart damage in young adults, as study finds. While likelihood of cardiomyopathy grows over time, the overall risk remains low. Young adults who were prescribed stimulant medication for ADHD were significantly more likely to develop cardiomyopathy, which is a weakened heart muscle, compared with those who were not prescribed the stimulants. While it may not help us learn more and it may just kind of keep us in our seat more, it may also open us up to possible health issues, so we got to be aware of that. A longitudinal study of boys aged 12 to 16 in the years 2005 to 2011 with stimulant-treated ADHD for at least 3 years, attending 3 pediatric practices, compared with longitudinal data from 174 boys from the Nepean longitudinal study, which is the controls, found possibly or stunted or slowed growth due to proven loss of appetite and weight loss of stimulants. This is another thing that happens. When we're on like a stimulant of some sort, it's going to make us not want to eat, and that can lead to not developing our body in ways that it needs to, especially as we're growing. It can lead to weight loss, it can lead to problems, it can even start an eating disorder sometimes. So we want to be careful of that. There's also a neurological interaction. Stimulants are designed to change the way a brain works. This can lead to late onset of puberty, increased cardiovascular events, and casual exposure to drugs could lead to later casual illegal drug use. So if we have the ADHD and we're doing these things, it can start messing with a lot of developmental aspects of things. It can start creating risks in cardiovascular systems, and it could open us up to possible later drug use as we keep going with it. Prolonged treatment, which is 3+ years with stimulant medication, was associated with a slower rate of physical development during puberty as well. So again, this stuff can really cause a lot of issues, and if we can take care of it through behavioral intervention, it's just going to lead to less problems and less things we need to figure out later. So if we can do that, let's do that. It's just going to work better. Again, though, medication can be a game changer. It can really do some amazing things. I've had some clients with ADHD that are connected to suicidal ideation, and they've actually become non-suicidal because of being medicated. So don't turn our back on this stuff and just say it doesn't work. I just really want to put out there the possible cons of this stuff and just cover that really quickly, because I feel often we talk about this stuff as just a way to help us focus, and that's it. We don't talk about all the things that come with it. So let's be aware of that and be aware that there are other ways to increase our focus and help us feel better. We don't have to just do it through medication, even though it could help out a lot. So talk to your doctor, whoever it is. If we can do that and you need to do that, let's do it. But, don't be afraid of trying the behavioral intervention first, because it might work a whole lot better than you think. Kind of a sidestep on that is medication is not enough by itself. And the reason for that is it's a crutch. It can help a lot, but it's not going to fix the problem itself. And the goal isn't to be on medication our whole life. That's not what we want. The goal is to use the medication as a crutch to get to the other side and let things heal or process or whatever we need to do to then continue on without it. We don't want people taking things for 60 years. So we want to get the support we need from the meds, because sometimes we need it. Sometimes, stuff is too overwhelming. Sometimes we're trying to talk about a trauma, or we're just so deep into a depression, or our ADHD is so all over the place that we can't focus on anything, that we can't get anything done. Those are points where medication is really helpful. Medication is going to help us get things done and help make things manageable so we can do the work we need to do, and then we can go further with it, with all the work without the medication. So we want to kind of think of it like a crutch. It's going to help us walk until we can walk on our own again. It helps to make things really manageable, especially when it's too difficult to process past trauma. That's a place where I like to really suggest these things and push people towards this stuff, because if we can't even get into the trauma or whatever the work is, it's going to be really hard to fix things. We got to get to that root. And so that medication can help us get there. There's a lot of stuff that can get in the way. The hardest thing with doing the work is if we're in constant crisis, if things are just overwhelming all the time. So using that medication as a crutch to keep us out of that crisis constantly can help us get things done and help things work out a little bit better. And sometimes that's exactly what we need. There are pros of medication, and I do want to talk about that a little bit, just so we make sure to understand what we can get from these things. I don't want this to just be like a talk about medications are bad, because that's not what this is. I just want to be really honest and truthful about how these things work, because these things aren't perfect either. It's a very new science that we're still trying to work on, and it's kind of like throwing darts at the wall to hope that something sticks. And if any of you have tried to get medications for mental health, you have seen that some things work really well, some things don't, some things come with side effects, and there's a whole lot of things in between. So going to the pros of it, antidepressants increase brain plasticity. A recent study sheds light on the mechanisms of neuroplasticity increased by the antidepressant fluoxetine. The reason I bring this up is that we have talked about that brain plasticity before. We've talked about it with psychedelics. We've talked about it with exercise. We've talked about it in a lot of different ways. That brain plasticity is about changing behaviors, changing beliefs, kind of those highways in our mind that our brain has created to make it just a whole lot easier to get to an answer or get to a conclusion. So antidepressants have shown to increase that brain plasticity so we can change how we feel about things, how we look at ourselves, how we feel about ourselves, and everything in between. Another study found that turning up your favorite song can improve medication efficacy. So while listening to your favorite song, it is a known mood booster, and it can actually make the medication we're taking more effective. So if you are taking things, feel free to listen to your favorite songs through your day best you can. Having a playlist for yourself can be nice, and that can really increase the benefits of these things and just make them more effective too. We have recently kind of got a new understanding of how antidepressants work. The serotonin boosting actions of antidepressants are essential and relieve depression by restoring normal communication and connections in the brain. So researchers from the University of Colorado medical campus have established a new framework for understanding how classic antidepressants work in treating major depressive disorder, re-emphasizing their importance and aiming to reframe clinical conversation around their role in treatment. This observation led to the idea that antidepressants work because they restore a chemical imbalance, such as a lack of serotonin. However, subsequent years of research showed no significant decrease to serotonin in people with depression. this is big because this is kind of showing us that idea of like brain chemicals being off and we just got to reset them up, or level them back out, and then everything works out better, isn't really what works. It isn't really how these things are working. We just got caught in that mindset to really increase people wanting to take medication, because there was a lot of pushback saying we don't need these things. So we wanted to kind of make it a little more common and normalize it and help it be a little more acceptable. But now we're seeing through research that it's not actually doing these things. It is working and helping still. It's just doing other things. This framework helps clarify how antidepressants like SSRIs are still helpful even if MDD isn't caused by a lack of serotonin. The best evidence of changes in the brain in people suffering from MDD is that some brain regions are not communicating with each other normally. So certain areas of our brain aren't working the way they need to work. And this is why we have found success, especially with treatment-resistant depression, through magnets, using different magnet techniques that can help kind of turn some brain regions back on, using the electrical stimulation. And like I talked about before, it's not shocking our whole brain like One Flew Over the Cuckoo's Nest. This is more of just like creating electrical stimulation to certain parts of the brain to reactivate them so we can start using them again. We got also other kinds of drugs that help get this stuff going again, but really just reactivating these brain regions so that we can use them is kind of the thing that's going to help us get there. When the parts of the brain responsible for reward, happiness, mood, self-esteem, and even problem solving in some cases are not communicating with each other properly, they can't do their jobs properly. And this causes pain, it causes suffering, it causes sadness, it causes issues. There is good evidence that antidepressants that increase serotonin, like SSRIs, all work by restoring the strength of the connections between these regions of the brain. This also happens with novel therapeutics like we've talked about before, like ketamine and psychedelics. This form of neuroplasticity helps release brain circuits from being stuck in a pathological state, ultimately leading to a restoration of healthy brain function. If we get that brain back where it needs to go, things just work better. Now jumping into the cons of medication. Like I was talking about, it's kind of like throwing darts at a wall and seeing what sticks. Sometimes people think the work is done and you don't have to work on making changes with this stuff, and that's not true. That's kind of the idea of it being crutch again. So we want to help ourselves do the work. We want to get to the other side of things. But we don't want to just take the medication and be done. That's not going to be the solution. You guys are going to get stuck on it. You're going to keep increasing the dose because you'll get used to it, and it's going to stop working at a certain point. You're going to be on some really high doses with some really tough side effects, and then you might need more meds to kind of deal with that. So we got to do the behavioral intervention. We got to change things. We can't just let things be the same and just take the medication and that's it. That's more substance use than it is actually helping us. Kind of what I was saying with that throwing darts at the wall to hope something sticks is the idea that different meds work for different people. There's no one size fits all. We try things out. We like to try things out that are most research first to see if it works, but they're going to have different side effects for everybody, and sometimes they're going to work for people and sometimes they're going to do nothing for people. They have gotten better with certain testing to see which things are going to work better for people genetically, so they're able to look a little deeper into it and get a little accurate with what to start with, but it hasn't. It's still imperfect in a lot of ways. It hasn't been finished with what they're doing, and they're still working on it and trying to understand it a little bit more because the brain's just a really complex thing. The hard thing with it is when you change something, other things changes in the brain too. It's not like a static thing where you just change one thing and it just stays that way. There's adjustment everywhere, and it impacts kind of a lot of stuff. Sometimes people lean too heavily on meds too, and you see this a lot with like anxiety, where people will take different things to kind of just relax, like a Xanax or something to kind of turn it off. The issue with that is what happens if you don't have it. You're kind of creating like a substance use issue of like, I need this thing, I have this dependence on this thing, otherwise I can't handle things. So we want to be able to use the behavioral interventions as well, and when things are really intense, really tough, we're in those special situations where we're just completely overwhelmed, that's where the meds can really help as a crutch to get us across, but we want to really focus on the behavioral intervention and just changing things in our life to make it better. Like we talked about, there's a lot of side effects. It's rare to take a medication in mental health in general that doesn't have some sort of side effect. It might be really minimal in your life where it doesn't do anything, but there are side effects that can cause issues with relationships, with self-esteem, with your job, whatever it is. So we got to be mindful of that, and it is easy to start getting onto like 10 different meds really quickly because you take one, it comes with side effects, you take another for those side effects, and you get another thing, and then it just keeps coming. Like something that's pretty common with ADHD is you get people put on a stimulant that helps them through the day, but then they also get some kind of sleeping med later in the day so they can turn off and go to sleep. And if there's any side effects from any of those, you might get more and more and more. And I've had some clients coming in at like 9 years old where they have like 10 different medications and it doesn't really help. Sometimes the best thing to do then is to really pull back everything, let it reset, see where we're actually at. Because we don't know what's being caused by a medication, what's a side effect, or what's just them. We don't want to get too caught up just medicating everything. That's not really the solution either. That's kind of just the way we live life in our society of looking for pills to fix things. And I know we want that quick fix, but if you try and do the quick fix, it's very unstable and it doesn't really last very long. We want to do the work, and I know it takes time, and I know the work is long. But if you do the work that takes time and is long, you're going to have success for long times because you're building a really strong foundation to work on. Another thing that comes up that we don't really talk about is the need to wean off medications, because there is a withdrawal effect when you try and stop these things, and that can cause people to think they have to stay on it, or they think they can't live their life without it because they're having these withdrawal effects. So withdrawal is the thing with mental health medications and with prescription meds, and sometimes we need to wean them off. Hopefully a good doctor is weaning you off as you're doing it. But sometimes people just try and stop these things, and then they tell themselves they can't do their stuff without their antidepressant or their anxiety med or whatever it is. And that's not really true. You might just be going through withdrawal. Try and wean through it, but try and understand that you might feel some side effects of just coming off of it, and it may not feel good, but give it time and see how you're actually feeling. Let it get out of your body. Don't just get caught up in that initial reaction. Another part that comes up is just cost. Sometimes it's expensive to get these things, and that can cause a lot of problems by itself. Behavioral intervention can be costly to get, especially if we're getting it from a therapist, but if we can get these things and practice these things, you don't really need to pay for them long term. You just learn them and then do them. So thinking about how to manage it, there are some things you can do. We can get medication if it's needed, or if we can't function without it. But we want to do talk therapy and try to improve and manage all of the stresses in our life or make needed changes to make life feel better. We want to create a life worth living. We don't want to get stuck just trying to cover something up or numb something out. That's not going to really help us. We can use these medications to help us set up, help us get where we need to go. But we got to do the work. Make sure you don't lose sight of that. Make sure we don't lose sight of trying to get to the root of things and actually take care of that, because that's going to help more than anything else. Another thing we can do is that self-care stuff. Adjusting our self-care, taking care of our diet and lifestyle, whether it's exercise, what we're doing in our daily life, how much sleep we're getting, all these things, that can really help us. That's our armor to deal with things. So even if we have, say, anxiety or ADHD or something, if your self-care is at like a prime level, like things are going really well, the chances of you dealing with a whole bunch of consequences from that are just much lower. Take care of that body, take care of you. The more you take care of you, the easier things are. That can be a really helpful one on everything. The other thing is focus exercises. There's a lot of things you can do. We've talked about a couple brain activities that you can use that kind of go around focus. They can help out. Find things that you like and use those. It could be like daily routines. It could be something you use when you're just in the moment and things are feeling really bad, or it could be something else. There are some exercises you can focus on to improve that focus, such as mindfulness like we talked about. And there are thousands of different ways to practice mindfulness. That's a great one to just explore what you like to do that's mindful. That could be meditating. That could be just like focusing on your muscles as you're working out, really feeling every single thing that's happening. It could be mindfulness eating, where you're just really eating and focusing on just the sensations and the textures and tastes and all that stuff. It's just kind of really being fully present in the moment and keeping that focus there. And you're going to have times that the focus drifts. That's normal. We just want to keep bringing it back to that present moment and keep practicing that mindfulness. An actual activity you can do to build that focus is actually taking a blank piece of paper, drawing a dot on it, and then sitting down and staring at that dot on that paper as long as you can until your mind wanders or until your focus drifts and you start trying to look at something else. Focus is a muscle. So with this, you're kind of trying to make it really boring so that our body wants to avoid, so it wants to kind of go into that flight. And then you're going to kind of push yourself to build that muscle that I don't need to go into that flight. I can sit in this boredom and it's going to be okay. The more you build that up, the more control you have of that, the easier that goes. It's just a muscle. We just got to work on it. We just got to strengthen it. So anything that you have that's tough to do can be a good thing to use to increase that focus. You just want to keep doing it like reps or sets, and you will find in time it's easier to kind of hold your focus on these things. Explore that a little bit. See if that helps out at all and just increasing that focus. Focus is huge with finding success in our careers, in professions, in sports, and competitions. Focus is kind of that key to unlocking our potential in a lot of ways. And I want to kind of zoom out and look at where we're headed and why we're doing what we're doing, because I know being episode 11, we've talked about a lot of different things now, and some of this is focused on general topics like depression or anxiety or ADHD. Sometimes they're focused on specific things like distress tolerance skills, or looking at things as challenge and threats and activities you can use. And the reason for this is I'm really trying to lay out a good foundation of understanding how we work mentally, how we work as people, so that we can get deeper into performance focused episodes, because we're going to reference a lot of this stuff once we get into that. So I'm trying to really do like laying the groundwork for everybody to understand why we're doing these things. And then in those later episodes, we're going to get more specifically focused on certain things like how to increase focus and success in this very specific situation, those kind of things. It's just going to be a whole lot easier to talk about that stuff with this foundation already there. So you guys already have that understanding, and having that general understanding of mental health and how it impacts us. Because once we get to that point, we can really increase some things. We just got to know what's underneath and what's getting in the way, because we won't always realize what the barriers are, and we're just getting stuck, and that's just frustrating. So these are areas to explore to see what barriers are there, what things are working, kind of setting yourself up for success, and then we can get really fine-tuned of getting to these goals and setting ourselves up for some really awesome things. So we will get more into performance-focused episodes, because that's our goal here at Premier Performance, is we're trying to increase that performance and go to those top levels, hitting those premier leagues where you feel like you can reach all these levels you never thought were possible. But to get there, we got to have the understanding and climb the bottom rungs of the ladder first. So I wanted to put that out there just so you guys know what's coming. We're going to have more good stuff coming out on all of that. And if there are certain things in your life that you want me to focus on to have as that foundation to understand as we climb and get into the more performance focused side of things, that I can put that out for you, and I'd love to do that. And that's also the side of things of just asking questions. We can always do episodes in the future where we're just focusing on a lot of different questions and conversations that I've had with people. And I have been talking to people that are listening to this stuff, which has been awesome. So keep reaching out. I just want to give you guys things that are helpful for you to understand where you're at, kind of understand that water, and then we can really get swimming, really get moving. Recognition is the first step. And that's the thing with understanding what you need and understanding this foundation. So we want to understand what's going on, what's going wrong, what we might need to change. So we always want to pay attention to that recognition. This can be helpful for a lot of different people. If you know anyone that struggles with ADHD or is curious about medication or has questions about it, share it to them. If you just want to put this out there for people so they can explore it on their own, put it out there. My whole goal of this is just increasing awareness and increasing education for people so they understand how they work. And we're not lost in the dark, just feeling like things are happening to us and we don't know what's going on. I just want to kind of shine some light on this all for you guys and make it a little more easier to manage. With it, I make it a point to give you guys actionable tools to find success in your life. And I want to know if it's helping. I love staying connected with you guys. And if it's not working out, or you're not sure how to use it, or you want some help specifically of what to do with it, leave comments, reach out, send messages, call me, text me, send emails, whatever you want to do. Even if you want to do it anonymously, that's totally fine. I just want to help. I want to be a resource for you guys. So don't be afraid to reach out and let me know what you're feeling. So if you do want to reach out, there's a lot of ways to do it. First way you can do it is through my email, just tmailer@premierperformancereno.com. My last name spelled Mahler. You can text or call me directly at 775-561-0056. You got my Instagram you can reach out on, premier_performance_Reno. The TikTok, premier_performance_Reno. And then our Facebook page and our LinkedIn page, which is Premier Performance LLC. Subscribe to us, follow us, connect with us, and, tune in wherever you find this stuff. If you want to check out the video version of it all, it's on YouTube and Spotify. Feel free to check that out. And we're just going to keep putting out good stuff and keep helping you guys through things in life. And just let me know whatever you need or whatever could be helpful. I love hearing from you all. Next week, we're going to continue with it all and go more into relationships and communication. This is going to be helpful working with people as teams, working on with coworkers, building up relationships in our life, which can help us just feel better and feel happier. And then communication is kind of that like lifeblood of a lot of these things, and it keeps these things going. So we'll get into all of that and how we can use that and what you can do about that. And if you have specific questions related to that you want to reach out and ask me about, just let me know. We can always get into those things specifically too. I hope you guys have a good one. I hope this was helpful. If you guys gotten something good from it, keep going with it. The key is consistency. If you find something that works, just keep doing it. Don't fall off of it. And if you have, just get it back and keep going. Go be the best you can be and find that premier performance. Create that premier mindset. Let's see where it takes you. I hope you guys reach your goals and find that success you're looking for. And I'll see you guys next week. Have a good one.